What is the most critical step in phlebotomy before drawing blood? A. Wearing gloves. B. Identifying the patient correctly. C. Cleaning the puncture site. D. Labeling the specimen. Answer, B. Proper patient identification is the most important step to prevent specimen mix-ups and medical errors. What should a phlebotomist do if a patient cannot provide verbal confirmation of their identity? A. Ask a colleague for verification. B. Use the patient's ID band or documentation. C. Skip the identification step. D. Assume the information is correct based on the requisition form. Answer, B. If a patient cannot confirm their identity, the ID band or medical records should be checked to ensure accuracy. Which of the following is an acceptable patient identifier? A. Patient's favorite color. B. Patient's last name only. C. Patient's full name and date of birth. D. Patient's room number. Answer, C. Full name and date of birth are standard patient identifiers to confirm identity before specimen collection. If a patient is unconscious and lacks an identification band, what should the phlebotomist do? A. Draw blood and label it later. B. Assign an arbitrary ID number. C. Notify the nurse or physician immediately. D. Ask another patient for their name. Answer, C. Unidentified patients must have proper ID verification by hospital staff before blood collection to prevent errors. Before performing a venipuncture, the phlebotomist must A. Use any available needle size. B. Verify patient identification. C. Always choose the right arm. D. Collect blood without gloves. Answer, B. Patient identity must be confirmed before drawing blood to ensure the correct patient receives the correct test results. What is the purpose of asking a patient about fasting before a blood test? A. To ensure patient comfort. B. To determine eligibility for the test. C. To verify if they need a glucose test. D. To assess hydration levels. Answer, B. Some tests, like glucose and lipid panels, require fasting. Non-fasting samples may lead to inaccurate results. A phlebotomist should never rely solely on what for patient identification? A. Verbal confirmation. B. Hospital wristband. C. A requisition form. D. A government-issued ID. Answer, C. Requisition forms can contain errors, so always confirm identity using two unique identifiers, e.g. name and DOB. If a patient refuses to have their blood drawn, what is the appropriate action? A. Force the patient to comply. B. Explain the importance of the test and document refusal if they still decline. C. Ignore the patient's wishes. D. Call security. Answer, B. Patients have the right to refuse medical procedures. Educate them on its importance and document their refusal. What should a phlebotomist do if a patient states they have a fear of needles? A. Ignore the patient's concerns. B. Offer support and distract them. C. Delay the blood draw indefinitely. D. Request a physician's presence. Answer, B. Reassuring and distracting a patient can help reduce anxiety and make the procedure more comfortable. Which type of patient requires special ID protocols before a blood draw? A. Pediatric patients. B. Outpatients. C. Patients in a mental health unit. D. Blood bank donors. Answer, D. Blood bank donors require additional ID verification to ensure proper blood type matching and patient safety. If a patient is wearing an outdated ID band, the phlebotomist should A. Ignore it and proceed. B. Ask the patient to verify details. C. Request an updated ID band before drawing blood. D. Use the requisition form as identification. Answer, C. Old or incorrect ID bands must be replaced before any procedure to ensure patient safety. The primary reason for confirming a patient's identity before venipuncture is A. To avoid double-checking paperwork. B. To ensure the correct patient receives the correct test results. C. To minimize time spent in the lab. D. To ensure a successful venipuncture. Answer: B. Proper identification prevents medical errors and ensures test accuracy for the correct patient. What should be done if an outpatient does not have an ID form of any kind? A. Refuse service. B. Allow the patient to state their name and date of birth. C. Use physical appearance for identification. D. Guess based on prior visits. Answer: B. Patients can verbally confirm their identity when no formal ID is available, but it must match the requisition form. The proper way to introduce yourself to a patient before drawing blood is A. Hi, I'm here to take your blood. B. I need to collect a sample from you. C. Hello, my name is, name, and I'm your phlebotomist. I will be drawing your blood today. D. This won't hurt a bit. Answer: C. Professional introductions help build patient trust and reduce anxiety before the procedure. When verifying a patient's name, the best approach is to A. Read the name on the ID band and proceed. B. Ask, are you, patient's name? C. Ask, can you please state your full name and date of birth? D. Assume you have the right patient. Answer: C. Patients should state their full name and DOB to avoid errors due to misheard or assumed identities. The best way to confirm a fasting status is to ask A. Did you eat anything this morning? B. Have you had anything to eat or drink, except water, in the last 8 to 12 hours? C. Did the doctor tell you to fast? D. Do you feel hungry? Answer: B. Specific questioning ensures patients understand fasting rules, which improves test accuracy. Which patient should be given priority in phlebotomy? A. A fasting patient. B. A routine outpatient. C. A walk-in patient. D. A pediatric patient. Answer: A. Fasting patients should be prioritized to ensure accurate test results and prevent discomfort. Which test requires strict patient identification protocols? A. Routine CBC. B. Lipid panel. C. Blood transfusion compatibility test. D. Liver function test. Answer: C. Blood transfusions require exact matches, making patient ID verification crucial to prevent fatal errors. If a patient is confused about why a test is being performed, what should the phlebotomist do? A. Tell them not to worry. B. Provide basic information and refer them to their physician. C. Refuse to draw blood. D. Guess an explanation. Answer: B. Phlebotomists should inform patients about the test but refer medical concerns to the physician. What should a phlebotomist do if a patient provides a name that is slightly different from the one on the requisition form? A. Proceed with the blood draw since names often have variations. B. Ask the patient for additional identifiers, such as date of birth, and verify with hospital records. C. Assume it's a clerical error and continue. D. Refuse to collect the sample under any circumstances. Answer: B. Minor name discrepancies must be verified using other identifiers, e.g., DOB or medical record number, to prevent errors. What is the safest way to label a blood sample? A. Label it before collecting the sample. B. Label it after leaving the patient's bedside. C. Label it immediately after collection, in front of the patient. D. Have the patient label the sample themselves. Answer: C. Proper labeling must be done immediately in front of the patient to prevent misidentification and specimen mix-ups. What is the best way to verify a patient's fasting status? A. Ask the patient if they followed their doctor's instructions. B. Check the patient's hospital records. C. Assume they are fasting if their appointment is early in the morning. D. Wait for the doctor's confirmation. Answer A. Direct patient confirmation is the best way to ensure compliance with fasting requirements for accurate test results. If a phlebotomist enters a hospital room and finds two patients with the same last name, what should they do? A. Check the bed number and proceed. B. Ask for their date of birth and check ID bands. C. Assume the correct patient based on physical appearance. D. Collect blood from both and sort them out later. Answer B. Using two unique identifiers, such as name and date of birth, prevents errors when dealing with similar names. What should a phlebotomist do if a patient does not have an identification wristband in a hospital setting? A. Proceed if the nurse confirms the patient's identity. B. Refuse to draw blood until an ID band is provided. C. Ask another patient for verification. D. Use the requisition form as an alternative identification method. Answer B. Phlebotomy should not proceed without proper patient identification, as ID bands are the standard verification method. Why is it important for a phlebotomist to confirm test requirements with the patient? A. To ensure the patient knows why they are being tested. B. To verify fasting or medication restrictions that could affect results. C. To double-check if the test is necessary. D. To make conversation and ease the patient's anxiety. Answer B. Confirming test requirements ensures the patient has followed necessary instructions, e.g., fasting, medication restrictions, for accurate results.